Talking about some warm temperatures. We're also talking about if you suffer from chronic and acute joint pain, listen closely. Dr. McPhail of McPhail Chiropractic is the place to go for help, and he's here today to tell us about this high-powered cold laser which can do wonders for your pain. Dr. McPhail, welcome to the show.
Thank you,
and I have been talking during the commercial break. This is the only machine of its kind anywhere in the Low Country. The only other one is in the upstate, up around the Greenville area.
Up in Greenville area.
Yeah.
Yes, sir.
Yeah, so people can come if they have, tell us about chronic pain, joint pain, because you showed me some pictures of folks that try to lift their arms, and for years they haven't been able to lift it maybe more than halfway,
right,
but now they've got full rotation.
Okay, for shoulders, for example, which we're talking about today, whether it's due to degenerative conditions like arthritic changes in the shoulder joint or torn rotator cuff that has turned into a more of a chronic problem, we're able to stimulate the healing response with this high-energy cold laser. What it does is it helps the cells to regenerate very quickly. It also does a really good job of decreasing pain and inflammation. Basically, it's called cellular respiration. It helps get things moving and healing.
Stimulating the healing process.
Exactly.
Very interesting. Just with this cold laser.
With a cold laser, yep. What it's able to do is penetrate the tissues and get down into the joint and really do a good job of healing those areas. And it is a cold laser, which means it does not produce heat. And
this is robotic in motion, and then we can show some of those pictures as well of some of the folks that had limited amount of motion in their arms. You showed me one guy for a number of years could only raise his arms up about this high, and now he can completely go up, and that's with about 10 minutes of the therapy with the laser.
That's right.
Wow, that is incredible.
Usually within the first 2 treatments, we're going to see significant changes. From there, we treat a little bit more to help the tissues heal, so that they get the full range of motion back. We have patients who, the one you're talking about, for years through high school couldn't raise his arms, couldn't lift weights because of the restrictions there. And 2 treatments, we got his arms completely over his head. Have other patients who have multiple surgeries on both of their shoulders who couldn't raise their arms. I mean, it's difficult to reach in to get a coffee mug or things like that just around the house with that restriction.
And it's frustrating, especially when you're under the age of 100 years old.
Right,
it's very frustrating not to be able to do it. Now, you've got some really cool glasses here.
Yes, we do have. This is a laser. Although it's a cold laser, we do like to protect our eyes for this. But
and I'm actually going to get my hand down a little bit here. And we were doing this a little while ago. And the three things that I notice about this is that it's painless, no pain at all. It's just a little bit warm.
Yep.
But I mean, it's not something that you want to remove your hand. I mean, it feels good, it works, and this is FDA approved as well.
It is. This is one of the only FDA approved Class 4 lasers that does not produce heat, and it's patented for that. And the benefit of that is we're able to treat an area for a longer period of time. Okay, traditionally with a Class 4 laser, you can only treat for 30 seconds to a minute or so on an area, and you have to keep it moving. Where with this, we can treat the patient 8 to 10 minutes and really stimulate that healing response.
So the patient comes in and talks to you and says, Dr. Drew, I've got this problem in my shoulder. What are the next steps that go through? Well,
first thing we do a consultation, see what the patient's gone through up to that point, what's worked, what hasn't. We'll do a physical and neurological evaluation on the patient, as well as we'll take some x-rays of the joint to see just the amount of degeneration there, try to determine exactly what's going on. And from there, we'll determine just how many treatments and what to expect. And
pinpoint the area, and then let the laser do the rest. And a lot of times, it's not a physical therapy that you have to go through after this. It's already started the process of healing the areas that have been damaged.
That's right, and it works for the shoulder, pretty much any degenerative knee joints, the knees, lumbar spine, degenerative disc disease. We get phenomenal results in decreasing pain with that as well.
Now, you guys are located up in the Summerville area on Old Trolley Road?
That's right. We're on Trolley Road, on the Dorchester Road end of Trolley. And on Tuesdays at 3 o'clock, I do have workshops, seminars that I do on the different conditions and how we're able to effectively manage it without surgery and without injections.
That is wonderful. Give those folks a call right there at 873-2225. Very easy, 873 back. And also you can email Dr. Drew at drmcfail, that's McPhail.com. They're located on 1709 Old Trolley Road. And we're going to have you back here in a couple of weeks, maybe a month, talking about lower joints like the knees.
Yes.
And I may let you put that on me right there, because I've had some major problems. Well, they've been some problems over the years in my right knee, and I'd love to get back to running again.
Well, I look forward to it.
Yes, sir. Good to see you. Thank you, sir. Thank you, Dr. McPhail. Up next.